Hello and welcome to the Caring Matters podcast. I'm Liz Tassone, and today I'm with Betsy Needels. And Betsy is a social worker with Hospice of the Bluegrass. And she's with us today. She used to work for Catholic Charities here, and while she was here, she did some training on communicating effectively with healthcare professionals. So Betsy, tell us a little bit about that training and why you're here today.
There was actually a workshop that was put together by the National Family Caregiver Association, and they did a lot of research into how to improve communication between caregivers and healthcare professionals. And they did a train the trainer kind of program several years ago, and that was something that I was certified to do, and I've been doing those trainings for the last 8 or so years here as part of Catholic Charities. Just to be able to offer that to caregivers seems to be something of interest. So it's a hot topic, I think, right now.
Yeah, and I think we need to let you know that if your group is interested in having Betsy speak about this topic, you can call the care line at 513-929-GIVE, which is also 513-929-4483. So if you want to have her speak about this after you hear a little bit about it to a group, just call that number and we'll see if we can get that arranged. So this is a hot topic because so many caregivers head to the doctor with their loved ones and sometimes come away from those feeling like they probably didn't get everything done and they're less effective than they would like to be. So why don't you begin with telling us the preparation that a caregiver should do prior to the doctor's visit to get the most for your money on this?
And this is something I don't know that a lot of caregivers really think about as they're making appointments to go to the doctor or the specialist or whoever they're seeing, because you're so busy as a caregiver. You know, obviously there's not always a lot of time to sit down and pre-plan what kinds of questions you're going to ask. So sometimes it helps just to have some reminders of what things can help you be prepared. And probably the most important thing I encourage caregivers to do is to learn about whatever the illness is or disease that they're dealing with. If they're caring for a parent with Alzheimer's or dementia, or a spouse with cancer or ALS or one of the many diseases, or it could just be old age, but learn about what that entails. And so then the next question, logically, that a lot of caregivers say is, well, where do you look for that information? And so there are lots of resources. We're here in the Cincinnati, Ohio area, and there's a wealth of information, really pretty much right at our fingertips here. We're very fortunate in that regard. The Caregiver Assistance Network through Catholic Charities has a hotline you can call to get information. They can link you with organizations that specialize in certain diseases, the Alzheimer's Association, MS Society, give you information for those groups. They can send you information about aging and age-related changes if it's something kind of generic or general. A lot of people ask about the internet and how reliable is that as a resource. There are certainly a lot of reliable sources on the internet that you can find for those who are technically savvy. Now, I know a lot of our caregivers don't have time, or some of them are elderly themselves and aren't familiar with using that technology. But the internet is a great resource. If you aren't familiar with using it, most libraries will have people that could help you. I know Deaconess Hospital here has a wonderful resource center that you can call and just have them look up information for you. The main thing with the internet, though, is to make sure when you're presenting your information to the doctor to say, this is what I learned about this disease and these are the questions I have, make sure it's a reliable source. You know, the doctor, if you just say, well, I Googled it and this was the first thing that came up, that may or may not be the most reliable website that you found the information on. So ask other caregivers. There's a wonderful network of caregiver support groups in this city, and that's a wonderful resource to meet with other caregivers to find out where they have found reliable information, as well as information about the diseases or illnesses themselves. So I think the more you learn about the illness, the better prepared you can be to know what questions to even ask.
Okay. So the first step is to just know about this specific reason that you're going to the doctor to know more about this particular disease
Right.
or whatever seems to be the issue that leads you to this doctor's appointment.
Right.
So that's the first step.
Right.
Okay.
Number 2 is make a list. And this is probably the one that most people think of when they think in terms of preparing. And that usually, then they say, well, I don't know what to add to the list. And that's where some of the research comes in is if you research a cancer or strokes, a lot of times there'll be sites that tell you specifically what questions should you be asking. But making a list of not only your questions about the illness, but about what your concerns as a caregiver are can be extremely helpful. And actually, as part of the workshop, there's a manual that has some suggestions also in it as part of the manual for the workshop that I do that has kind of a guide to help you think about what questions to ask and what your concerns might be. For example, just having good records and kind of journaling what your loved one or your care receiver's routine is like. Are they sleeping? Are they eating? What kind of schedule are they keeping? What medications are they on? Having a list of those things is a wonderful thing to have at your fingertips. And one of the things that a lot of caregivers do, and I highly recommend, is to have what we call a patient file. And it can be as simple as just a 2-pocket folder where you keep all of that vital information about insurance cards, advance directives, if there's power of attorney documents,
medication,
a current list of medications. Now I know a current list can be difficult to keep up with, but a current list of medications, because every time you go to the doctor, they are going to ask, what medications are you on and what doses and how frequently are you taking it? So that's all stuff that if you have right there in that folder, you can access it quickly. If there's an emergency with you as the caregiver, it also can be very helpful for whoever has to fill in for you as the caregiver.
Oh, good idea. Because maybe you're not the one that is always with your mother.
Right. And we hear a lot about caregivers whose health is compromised because of the stress that they're under and because of their caregiving responsibilities. And a lot of times they begin to have health issues themselves. And so, if there's an emergency, it'd be easy enough to say to this extra person who's filling in for you, grab the folder on top of the fridge. That has everything you need.
Right.
So a patient file is a wonderful thing to have.
Yeah, and you think you're going to remember the drugs and everything that the person takes that you may not remember as you're sitting there. Oh, what was it I, take occasionally or whatever. So it's important to have things written down to just jog your memory on this.
And also to be able to document, maybe this is something that's prescribed, but mom always refuses to take it. So, that's something you would want to have on your information when you're planning to go to the doctor. Yes, mom has been prescribed this particular medication, but for some reason she has difficulty swallowing it every time, or she refuses to take it. So keeping good records of what those patterns are, if there's patterns of emotional things that you can write down in terms of mom's more anxious in the morning than the evening, or my husband's sleeping better during the day than the night, or whatever patterns, that's going to help the physician put the pieces of the puzzle together. But the caregiver has so many of those pieces of the puzzle that it really is important to share all of those details that you can.
And just as you're saying this, I'm thinking of even my own visits. A lot of times that first visit with a doctor, they're going to say, well, keep an eye on it and get back with me. Keep a headache journal and get back with me. So you're saying if you've got all this already kind of documented, then you can get right to business with the physician on that very first visit.
Right. It's a way to be a little bit more proactive.
Yeah.
In that sense.
Yeah. There is a lot to this topic, and so we're going to end this one very shortly, but what we want you to do is stay tuned for next time, because we're going to continue this, because this is about preparing for the doctor's visit. Next time we're going to talk about that visit itself, so make sure you watch again the following week on that. I'm Liz Tassone, and for the Caring Matters website, and I just want to thank our sponsors on this website, which are Healthcare by Blackstone, Vitas Hospice, Landfair Retirement Community, Hillebrand Home Health, Independent U, Lifespan and Family Bridges Home Care. So I'm Liz, I'm with Caring Matters Podcast, today with Betsy Needels, and I just want to say, always remember that caring matters.